Thus, you and I have both been involved in CHRODIS and CHRODIS Plus, and looking back on CHRODIS Plus, for me the reflection would be whether what they aim to do was achieved. I think the key is this phrase, the focus being on tangible transnational activities with the potential to trigger health and chronic disease policies in member states with the perspective to improve health outcomes.
Indeed, but sometimes there's also beauty in the process. And the choice of having a significantly different structure in this joint action than a lot of others, where you got your feet wet, where you tried to implement things as part of the process and learn from that, has been a very huge benefit, I guess.
Yeah, I think that certainly one of the learning points was recognizing that in the planning, the aim to involve multiple stakeholders, as many stakeholders as possible, was effective and had benefits. Perhaps what could be learned from that, though, was that there might have been more stakeholder engagement in the actual planning of the project.
There might, it's a vital point, but also that is the part of when you do implementation, that it is hard. It is not a straightforward path, and when you design policies, it's very, very important to also keep an eye on the quirks and the challenges of the implementation later on.
Yes. I think you mentioned later on, one of the lessons I think that learnt is really about the march of time, if you like, that things take much longer than you might want them to. And that's the reality of implementation. It's a long-term process and will go well beyond a 3-year period, for example. The other thing maybe to learn is to recognize while patient empowerment was an important element in the guide and attention paid to it, people had very different starting points.
True. But it also is worth remembering that this is a long game. You can sometimes overestimate what you can do in 3 years, but you have a tendency to underestimate in what you can do in 10. And anyone that's been part of 2020 will know that in the course of the next 10 years, there's both a need and a huge potential to change the health and well-being of Europe.